afternoon, everyone. I'm Liz Charlotte, Director of Communications for the Mississippi State Department of Health. Once again, we have a lot going on. Topping the list today is sadly our 7th pediatric death. We also have increasing deaths among pregnant women and a continuing lack of ICU beds. So I'd like to start with State Health Officer Dr. Thomas Dobbs and talk a little bit about what's going on with the pregnant women and vaccination status. Can you kind of give us an overview on that, Thomas?
You bet. And thanks everybody for joining us. You know, it's been a rough month and a half. The Delta surge has really been stressful. It's overwhelmed our health system and it's caused a lot of unnecessary deaths. Fortunately, we are starting to see an inflection point with somewhat of a decline in hospitalizations and daily cases, but we're seeing a pretty significant number of daily deaths, which we know do lag cases. And we're still logging thousands of deaths a day, of cases a day. And so we're still in the thick of the Delta surge. Sadly, we've seen a pretty significant number of pregnant women not survive COVID in recent weeks. Currently, we're investigating 8 reports of pregnant women who have died within the past several weeks, all of whom are unvaccinated. We do know that COVID is especially problematic and dangerous for pregnant women, but we also know it can be deadly for the baby in the womb. With COVID, we've seen a doubling of the rate of fetal demise or the death of the baby in the womb after 20 weeks. It's been a real tragedy. Please know that the vaccine is very helpful and can remarkably successful at preventing these severe outcomes in pregnant women. So we really want to make sure that we're making an effort to get pregnant women protected, to get pregnant women vaccinated. Expect to see more information coming out from us and with our partners to make sure we are protecting some of the most vulnerable people within our population. Additionally, if pregnant women do get COVID, they do also need to pursue monoclonal antibodies. So if you're pregnant and if you get COVID, please go ahead and check into getting monoclonal antibodies. Vaccines and antibodies are approved and recommended for pregnant women. Please know, CDC, the Society for Maternal Fetal Medicine, and the American College of OBGYNs strongly support vaccination for pregnant women. This is something we can do to save multiple lives at one time. Moving on to the concept of vaccinations, we are seeing ongoing success in our vaccination effort. We have almost 1.5 million people, almost half of the state has received at least 1 dose. So we are making some progress. We had over 50,000 doses of vaccine given last week, but we don't have near enough people in the state who are immune, either because of natural infection or because of vaccination, to keep us from having additional surges or to keep us from having additional outbreaks. So please, if you are not immune, if you've not been vaccinated, please go ahead and get vaccinated. We know it's extremely safe. It's extremely effective. We're seeing more and more data that shows us how incredibly safe it is. And we still know that the vast majority of our cases, hospitalization, and deaths are among those who are unvaccinated. Please keep in mind that although vaccination is our plan A, we know that's the best way to protect yourself. If in fact that you do get COVID, please explore, talk to your doctor, go to our website, msdh.ms.gov/MAB, call the hotline, and check into getting monoclonal antibody treatment. We know it's extremely effective, 80 to 90% at preventing hospitalization. It saves lives. And right now we have a statewide standing order such that you don't have to have a doctor's order to get monoclonal antibodies if you have COVID. So please, if you have COVID, go to our website or call the hotline. We have over 180 locations around the state, and a large number of those take direct referrals where you can come in and get monoclonal antibody treatment. We are very happy that additional types of monoclonal antibodies are now available. The bamlanivimab etesevimab, or one that we used a lot earlier that was not effective against Alpha variant is very effective against Delta. So we have additional tools available in our armamentarium to fight against COVID. Liz, I'll turn it over to you at this time. Thank you.
Thank you so much, Dr. Dobbs. State epidemiologist, Dr. Paul Byers. Sadly, we are reporting another pediatric death. So why don't we start with that?
Yeah, thank you, Liz. And thank you, Dr. Dobbs, as well. We have reported, and we are reporting an additional pediatric death. This is in a child less than a year of age. Today, we're reporting out over 1,900 additional cases, but over 100 additional deaths. And like I said, sadly, one of those deaths is in a child. That brings us up to 7 pediatric deaths that have been reported so far during this pandemic, dating back to our first cases and deaths back in March 2020. But when you look at our data for the number of cases that we are reporting, we are beginning to, like Dr. Dobbs said, have an inflection point. 1,900 cases today. When you look at our cases that we're reporting out from week to week, we are starting to see some stabilization, but not so much in the deaths. We are still seeing increased numbers of deaths. We anticipate that we're going to see that for a short time. When you have a very large surge of cases like we've had, sadly, the deaths follow 10 days to a couple of weeks after that. And so we may continue to see elevated numbers of deaths for a while longer now. We're not out of the woods yet. When you look at our cases and deaths that we had reported in August alone, we had over 93,000 cases to date reported in August. And we're not finished with August. Some of the cases that are being reported now still have dates that occurred in that August timeframe. So that number may increase. When we look at the number of deaths that we had reported in August, it's over 1,000 deaths now. And sadly, that number may grow as well as additional deaths are reported. And again, the overwhelming majority of the cases and hospitalizations that we're seeing and the deaths that we're seeing are sadly in unvaccinated individuals. And remember that, we have children less than the age of 12 that are not eligible for vaccination yet. And so it's going to be important for us moving forward to make sure that we keep those children as safe as possible. Certainly vaccination of those adults and those eligible members in the household is one of the best ways to keep the children safe. We'll talk a little bit more in a moment about some of the best practices in the school settings. But again, as Dr. Dobbs mentioned, we are starting to see some decreases in our number of confirmed cases that are in the hospital. This is encouraging, but they're still at very high levels. We're still reporting out today over 1,300 cases that are confirmed and hospitalized. And so those are high numbers compared to where we were at our previous high over the winter surge. Still over 400 individuals who were in the ICU due to COVID. Still over 300 individuals who were on the ventilator due to COVID. And unfortunately, we are seeing an increased proportion of our cases in the hospital that are pediatric cases. And we've seen a recent increase in August and September, again, of our pediatric hospitalizations. And at last count, just a few days ago, we had 24 pediatric cases in the hospital. And so this continues to be a concern moving forward. One of the bright spots is the impact in our school settings. Now, we've worked very hard over the last several months to provide our schools in Mississippi with the support that they need, the guidance that they need, access to testing and access to vaccinations, as well as giving them the best guidance we can to try to prevent transmission within the school setting. With over 800 schools reporting out for last week, on our most current report, we've seen a decline in the number of teachers and students and staff that are on quarantine. For the week of August 30th through September 3rd, 15,000 students were on quarantine compared to more than 23,000 in the previous week and more than 28,000 in the week prior to that. And we've seen some decreases in the number of teachers that have required quarantine as well, dropping down to 570 with our last report. We've seen some drops in the number of cases as well in students and teachers and staff, and the number of outbreaks in those settings as well. And again, these are encouraging indicators that are expected as we continue to see our cases drop. We have over 50 schools and school districts in the state that have signed up to participate in the testing through one of the phases that we have to offer. And over 5,000 tests have been conducted in the school setting so far. We have almost 100 schools and school districts that have signed up to be part of the vaccination effort. So the Adopt a School, actually, it's well over 100 now. 96 individual schools and an additional 26 school districts. And in those schools and school districts so far, over 1,100 vaccines have been given to school-age kids. And so these are the things that are going to be important to continue to keep our kids safe. And we've talked about this. MSDH has strongly recommended that there's universal masks in the K-12 settings indoors for all vaccinated and unvaccinated students, teachers, and staff. Participate in testing, do that screening testing to try to identify those cases early so that they can be excluded from the school setting, in fact, before we see transmission that occurs. And lastly, make sure that we're promoting vaccine as much as possible for those eligible students, teachers, and staff, and that we're facilitating it as best as possible. And that's what we're trying to do from the Department of Health. And we'll continue to work with those schools and those school settings. The last thing I'll talk about is we're continuing to get questions about ivermectin and ivermectin use for the treatment of COVID. I just want to be clear that the biggest thing that we're recommending from the Department of Health is if you test positive for COVID, consult with your physician. Get monoclonal antibodies if they're indicated. We have broad utilization across the state and broad availability across the state for monoclonal antibodies. As Dr. Dobbs indicated, monoclonal antibodies have been shown to decrease the risk of developing severe disease, hospitalization, and death. But what we do recommend is that, talk to your doctor if you're COVID positive as well. Take medications only that your doctor prescribed. Please don't go and take livestock medications, whether it's livestock ivermectin or other livestock medications. These medications are highly concentrated and they can be toxic for humans. And so please, that's the real message that we want to say about ivermectin is please consult your doctor, take medications prescribed by your doctor, and don't take medications that are indicated for livestock. And Liz, that's really all I have today. Thank y'all for the opportunity again to speak with y'all.
Dr. Byers, before I let you get away, let's talk a little bit. We've gotten some questions about the Mu variant that has been seen in many states. Can you give us an update on that?
I sure can. I think first we want to say that almost 100% of the strains of COVID that we're identifying in Mississippi right now are Delta. And it's been that way for a number of weeks. We've talked about the fact that Delta is very infectious. And right now, it is overwhelmingly the predominant strain in the United States and in Mississippi. Now, there have been some discussions about Mu lately. There's been discussions about Lambda lately. And these are other variants of COVID that have been identified. Now, in Mississippi, we have identified cases of mu dating back to May of this year. 4 cases so far. I think one of the things that is important to remember is so far we have not seen wide transmission of this variant, or really wide transmission of any other variants except for Delta. We know that Delta is, like I said, highly infectious. It's the strain that is predominant and is responsible for the cases, the hospitalizations, and the deaths that we're seeing in the state right now. But, you know, it's important for us to continue our surveillance. We're going to continue to do our virologic surveillance to identify additional variants as they are reported out, and that we need to continue to look at them. And we'll continue to do investigation around those as well.
And Dr. Bars, did I hear you right that you said we have seen 4 cases identified as mu?
Yeah, dating back to May. And I think that that's an indication that that we have not seen significant spread of it in Mississippi, but we have identified some cases. And that's going to...
Go ahead, Dr. Byers.
No, ma'am, that's it. I think I'm done. Thank you.
All right, thank you so much for doing that. We continue to see a lack of ICU space in our hospitals. So let's start with that, Mr. Jim Craig, Senior Deputy and Director of Health Protection. Give us an update on the ICU situation.
Yeah, thanks, Liz. You know, we are seeing some small improvements in hospital bed availability around the state, but our ICU bed availability continues to be very scarce. You know, the COVID system of care still is active and mandatory for the hospitals in the state for transferring those critical care patients that can't be accommodated through the normal referral process. Our health officer order for the COVID system of care was renewed yesterday and is good through September 15th. The requirement for the delay of the Tier 1 and Tier 2 elective surgeries has been removed. So hospitals may resume Tier 1 and Tier 2 elective surgeries that lead to overnight hospital stays as space becomes available in our facilities. Since the COVID system of care was activated, Mississippi MedCom reports more than 2,127 patients have been transferred. You may have noticed that on our bed status reports on our websites, they're currently not active. Problems continue as the snapshots used for this report really don't reflect the dynamics of the system while the COVID system of care is active and space is limited. Hopefully we'll be on the backside of this wave soon, and when we're not bedding patients in the emergency rooms anymore, we can resume our daily snapshot reporting. But as of 8 o'clock this morning, critical care hospitals reported 10 ICU beds available with 202 emergency room holds. When you look at these 202 being cared for in an emergency room bed, 67 patients are waiting for an ICU bed. Of those 67 that are waiting for an ICU bed, 23 of those are COVID patients. So if you look at that, the number of patients that are waiting on an ICU bed and being cared for very appropriately in emergency rooms, the bed capacity for ICU space is effectively 0 still in the state of Mississippi. We have additional ICU capacity in some hospitals in the state. It could be used, but the problem remains of insufficient staffing to operate all of the beds. Again, with the governor's office and MEMA, they continue to, and our federal partners, we continue to get staffing agencies and others to help increase that ICU staffing so we can make those ICU beds available. So if we look on the federal front, yesterday we requested a 14-day extension of our federal partners at the VA to continue providing 5 ICU beds at the Jackson VA and 5 ICU beds down at the Biloxi VA for critical care rotation in the system of care. Our 23-person DoD team, our Department of Defense team, continues at UMMC, and we're waiting to hear back on our request to extend that team for an additional 30 days. We have a 7-person public health service team doing monoclonal antibody administration at the university, and we have requested that that team or a very similar resource be made available to the state to continue that mission. As an update, we'd like to thank Samaritan's Purse for coming to Mississippi and operating their field hospital over in Garage C at UMC. This dedicated team of physicians, caregivers helped by providing much needed ICU care, step-down care, and decompression support for hospitals during the recent storm, as well as just hospital decompression in total around the state. Their mission has ended, and they are in the process of demobilizing the field hospital. Our 23-person Department of Defense team continues assisting with COVID patients up at North Mississippi Medical Center, and we're also waiting to hear back on our request to extend that team for 30 additional days. Our 10 two-person federal teams continue to assist in the administration of monoclonal antibodies around the state. They are, in addition to those existing resources, as Dr. Dobbs said, there are a number of places around the state providing monoclonal antibody treatment. We have requested an extension of our current teams and an additional 9 teams to assist with administration of monoclonal antibodies in Mississippi. Our EMS services in Mississippi remain stretched thin to cover 911 calls and patient transfers. EMS services continue to report long wait times in hospitals as well as distant transfers, both of which are impacting their availability of local units to respond to 911 calls. Ambulance services also report sufficient number of trucks or ambulances, but they lack enough staffing. We did request additional EMS resources to help with this from FEMA, and last week we received 2 advanced life support strike teams to assist with critical care transfers. Each strike team is comprised of 5 advanced life support ambulances, and these units are being tasked through the COVID system of care by the Mississippi MedCom. Again, staffing for our hospitals remains a critical need around the state, especially to free up and open up ICU spaces. Working with the governor and MEMA, physicians, the critical care nurses, nurse practitioners, respiratory techs, and others continue to be deployed to hospitals to open much needed beds and ICU spaces. Currently, we have 1,167 staff that have been requested, and more than 75% of this staff have been deployed to hospitals and more current being placed daily. I want to share a couple slides to give an update on testing and vaccination efforts. If you look at our mobile testing site plan, you'll notice the site, and again, these are just state testing locations. There are lots of testing available in all parts of the state. The areas where we lack some enough free testing availability, we have increased our testing opportunities. Again, if you want to schedule a test at any of the locations you see on the map, covidschedule.umc.edu is the way to get there. If we look at some of the numbers for those testing locations, the Capital City testing site, which is at the corner of Woodrow Wilson and West Street at the old farmers market, from April 2021 through August 2021, 24,228 PCR specimens were collected, 25,331 rapid antigen tests were performed. If you look at all the other state testing sites that I showed on the map from June 2021 through August 2021, 18,261 PCR specimens were collected and 21,178 rapid antigen tests were performed. Changes for the week, our Adams County Safe Room in Natchez has moved to 2 full days starting yesterday. George County has moved to 2 half days starting yesterday in front of the George County Health Department. In Greene County, 2 half days starting yesterday at the Greene County Health Department. Humphreys County Health Department is 2 half days as well. And then at Jackson Community County Health Department down in Pascagoula has now moved to 5 full days. Jones and Laurel at the County Health Department there is at 3 full days starting today, I'm sorry. And Lafayette County Conference Center, this is a move from Lafayette County Health Department to the Conference Center. We're now there 5 full days starting yesterday. Just remember, anyone can be tested for COVID-19 free at any of these health department locations you saw on the map. Testing is encouraged for anyone who is symptomatic of COVID or if you've been exposed to someone with COVID, but anyone can be tested for free at those testing locations. Because of the high demand for testing that we still see in the state, please schedule an appointment ahead of time and provide some information to us about your symptoms. Again, you can make an appointment at the testing site but same-day appointments may not always be available. So please schedule your test at covidschedule.umc.edu or by calling 601-496-7200. If we look to vaccine, still a lot of activities going on, but a majority of our vaccination efforts here at the health department right now are through our health equity unit, as well as our community health centers and our COVID community vaccination partners. These are just some examples of the work for Pfizer first doses that the unit will be doing this week and going into next week in Vicksburg, Corinth, South Haven, a number of locations in Jackson and schools, as well as in Ridgeland and Pearl. Also additional Pfizer doses in some that are Pfizer and Moderna that will be offered in Meridian, Jackson, Columbus, Morton, Hattiesburg, Horn Lake, Vicksburg, Gulfport, Bolton, Houston, Greenville, Van Cleve, Starkville, and Columbia. And we have some second dose appointments coming up around the state in Houston, in Madison, Olive Branch, Morton, and Forest, down in Brookhaven, Moss Point, Jackson, Hattiesburg, Edwards, Pearl, and Indianola. Remember, free COVID vaccine is available at all county health departments in Mississippi during our normal days of operation. Again, schedule a free vaccination ahead of time so that you can receive quicker service, although same-day appointments may be available and usually are available. Third dose appointments are now available for those that are immunosuppressed, and appointments can be made at covidvaccine.umc.edu. Remember, if you're homebound and need assistance getting your COVID vaccine, send an email to the COVID homebound at msdh.ms.gov or call our hotline 7 a.m. to 7 p.m. 7 days a week at 877-978-6453. We're still looking to host events. As you saw, our health equity unit and others are working diligently to continue to create opportunities for vaccination around the state. If you have someone who's interested in putting an event together, give us a call at the COVID hotline at 877-978-6453, or they can send an email to vaccineevent@msdh.ms.gov. Last part of my update is really kind of an update on Hurricane Ida impacts. Our initial damage assessments have been completed for healthcare facilities in the state. All our hospitals and long-term care facilities are now reporting they're back on commercial power. We did have initial reports of 4 hospitals and 3 nursing homes with minor structural damage. For our public water systems, as of this morning, 98% of all our systems are operational, with 6 current boil water notices affecting approximately 4,710 Mississippians, much improved from the briefing last week. Town of Eden in Yazoo County is on boil water, as well as the village of Glendora in Tallahatchie County, Sunny Hill Water Association in Pike County, Oak Harbor in Hancock County, Sunrise Mobile Home Park in Hancock County, and Wright's Campground in Franklin County. Remember, if you receive water from one of these systems under a boil water notice, that you should not drink tap water. Bring the water to a rolling boil for 1 minute to kill most organisms before consuming it. Liz, that's all I got for today. Turn it back over to you.
All right, thank you, Mr. Craig. We appreciate your update. A couple things. When you guys sign on, please put your affiliated media outlet. So if I see a name on here right now, please put your affiliated media outlet. Okay, someone give me a thumbs up that you can hear me now. Okay, thank you, Jim. So go ahead and identify yourself. I know a lot of you, but please go in right now. And if you did not identify what media you are with when you signed in, please go ahead and do that. And MSDH staff, please do that as well, unless you're senior staff. Before we take questions, I wanted to alert you that next week's press conference will be Thursday at 2 instead of our traditional Wednesday time. And this is because we will have a very special and important guest, and we will also go more in depth into the investigations of pregnant women and COVID deaths. So I will send the media alert. I just want to give you a heads up. It won't be on Wednesday. It'll be on Thursday. So if you would like to attend, please go ahead and remember that. Okay, so we'll start with questions. Let's see. Brittany Clemens with Local 24 News in Memphis. Here is one of my questions for today when the time comes. What does contact tracing look like right now in Mississippi? How effective was it last year compared to right now? I'm going to give that to you, Dr. Byers.
You bet. So contact tracing in Mississippi, we're still conducting it. We still identify when those cases were reported, reach out to the infected individual, make sure that they understand that they need to isolate for the appropriate time, make sure that they're communicating with their contacts, that they need to quarantine, and we work to identify if they are potentially part of a larger outbreak setting that may require some additional investigation. And, this is pretty much the standard process we've been using now for quite some time. I think it's important to understand, though, that with the overwhelming number of cases that we have, and that we are dealing with a virus that is primarily through respiratory transmission, and in many cases, individuals may have minimal symptoms, may never even be identified as a case. I think this is one of the reasons why we want to remind everybody and encourage folks that if you do test positive, don't wait for a call from the health department. Go ahead and isolate for the appropriate time. Go ahead and reach out to your contacts and make sure your contacts are aware of your diagnosis and the fact that they need to get tested and they need to quarantine. This is just but one tool in the many tools that we have to try to interrupt transmission, of which the most important is vaccination. And so I don't know, did I answer the complete question?
I think you did. And Brittany, just write back if we still need to accommodate you with more information. And so Courtney Ann from WLBT, do we have an accurate way of tracking COVID deaths for pregnant women in the state? If so, can you share those numbers? So Dr. Byers, we talked, and Dr. Dobbs, we did talk about this a little bit. I'm going to do these one at a time. So you want to take the first one, Dr. Byers?
Yeah, so, one of the things that we want to make sure of when a death is reported is that we do get the pregnancy status on that individual. That's really one of the better ways for us to be able to tie it back to it being a pregnant woman. So, we're going to continue to work with those hospitals and make sure that our reporting and our surveillance is sound. We do have, and we do report out on our website the number of cases and deaths that have been reported to the Department of Health to date in pregnant women. But we're continuing to work with those hospitals to identify potentially additional deaths in pregnant women that may have occurred.
Thank you, Dr. Byers. Can you explain why the Delta variant, we have talked about this a little bit, has been so lethal for pregnant women who are not vaccinated? Do y'all feel like we covered that pretty well already? Dr. Dobbs, Dr. Byers?
I don't know that we've covered that specifically. I mean, we do know that COVID in general is a lot more dangerous for pregnant women. We've seen that for a long time. Pregnant women have changes in their physiology. Their immune response is a little bit different. This is not unique to COVID. It's the same as other disease states. So we have that situation, and then we have Delta, which is, I think we're starting to realize that it's actually a bit of a different animal. We know that it has a lot higher viral load. There's data that shows, a marked increase in hospitalization rates for folks who are infected with Delta, and it kind of fits along with our messaging, which I think is very accurate, that Delta is different and Delta is deadly, and we need to do everything we can to prevent transmission.
Thank you, Dr. Dobbs. And I think this is a great question. What is your advice to pregnant women and those who are breastfeeding about vaccine? We can't say it enough. Dr. Dobbs, please
Yes,
emphasize.
please. Yeah, please get vaccinated. I mean, you got to protect yourself. You got to protect your baby. You got to protect your family. The vaccine is phenomenally safe. Some of the lies and fear mongering out there, I think, have caused unnecessary fear. We know that COVID kills moms, and we know that it is dangerous. The vaccine has been shown to be very safe in moms and breastfeeding women, and it's strongly advocated for by CDC, ACOG, and the Society for Maternal Fetal Medicine.
I know this might sound like an odd question, but I just was wondering, because I know sometimes vaccine can maybe somewhat give a fetus some protection. Do we know that with the COVID vaccine, Dr. Dobbs, can it transfer and give the fetus some protection?
It should be able to. I don't have any data to that effect, but we do know that the mRNA vaccines do generate the type of antibodies that are secreted in breast milk. So there's a strong theoretical reason, although I haven't seen any data to say that it limits transmission.
Okay, thank you, Dr. Dobbs. Shalina from NPR. We saw that a lot more people started getting the vaccine due to the Delta surge. Do you think that this momentum is still high, or has it slowed down? If it has slowed down, what do you think is causing that? And I'm wondering if you think the FDA approval has any role to play in more people deciding to get the vaccine than a couple weeks ago. Dr. Byers, let's take this apart here. We're still seeing the momentum, I think, of people getting vaccinated.
I think the momentum is still high. I mean, we've dropped off a little bit in the last couple of weeks, but we still gave over 50,000 additional doses in the state last week, and still a very high number of people who were initiating the vaccine or getting their first dose, and that's encouraging. It was over 20,000 folks. And, in addition, we're seeing individuals who are taking action, and if they're immunocompromised, who are going ahead and getting that third dose to make sure that they're protected. Over 30,000 people in the state have gotten that third dose of an mRNA vaccine. And again, those things are encouraging. We don't want that to slow down, though. We want to continue that momentum. And I think, especially as we head into the possibility of booster doses later in this month, depending on what the CDC and the FDA's final guidance is. I think folks need to be prepared to take action on that when that booster dose is available based on the time frame that's recommended by the CDC. But now's not the time to let this drop. I know that we have a tendency to kind of go up and down with our interest based on the number of cases and the number of deaths that we're seeing. We're very encouraged by the fact that we are starting to see some leveling off of the cases, are starting to see some minimal drops in the number of folks who are in the hospital due to COVID. But now's not the time to let our guard down. Now's the time to get that momentum continued. And we want as many folks as vaccinated as possible now, and not wait for that next big surge. Let's take the opportunity now before we get back into the same mess we've been in all these several weeks now.
Okay, thank you, Dr. Byers. And I guess, Dr. Dobbs, take that last part about the FDA approval for Pfizer. I believe that was for 16 and over. And Shalina is wondering if that has had any role to play in more people deciding to get it than a couple weeks ago. Are we able to answer that at this time?
We certainly were aware that that was a potential impediment, but we didn't see a bump in vaccinations following that announcement. Certainly, I think people recognizing that COVID pandemic was not over and the deadly nature of the Delta surge was a stronger motivator. So I think that got a lot of people off the fence who had been thinking about it for a while. There may have been some individual impacts for some folks about the FDA approval, but I don't know that we can see that there was an appreciable increase across the state for that reason.
Okay, thank you. Let's see. Has the department considered using contact tracing apps? I know we talked about that a long time ago. Dr. Byers, do you want to take that?
Yeah, we did consider using contact tracing apps, and we didn't feel like they were the best fit for the state at the time.
And of course, we don't require businesses to contact trace, so that would be,
No, we don't require them, but we certainly encourage businesses to identify when they have a case in their setting. And certainly we have guidance out that on our website that speaks to that, that if they identify a case in an employee, certainly identify those close contacts who were unvaccinated, exclude them from the workplace for the appropriate quarantine time, and recommend that they get tested. This is how businesses are going to continue to stay open, is if they take those actions to try to limit transmission within their settings.
and as far as we have actually hired additional contact tracers, haven't we?
We have, and we continue to expand and contract our contact tracing operation as needed based on the cases that we're seeing. I think, we want to keep things in context, guys, and contact tracing is important in those settings where you want to try to limit transmission. That's why we encourage places like schools, places like businesses to take action to identify those students, teachers, staff, employees who may be direct contacts to a known case. Make sure that if they're unvaccinated, are quarantined and excluded from the setting and get tested. And again, this is just another tool
Right.
for us to be able to limit transmission.
That's a great explanation, and it certainly is effective in slowing the spread. And she's also asking, despite it taking days before someone is notified, we have seen it.
I think that's the point I want to make.
Okay.
Guys, is let's don't, this is a team effort. This needs to be a group effort. And I encourage everybody that if you do test positive, you need to isolate. You need to let those folks around you know that you've tested positive so they can take appropriate action, whether it's testing, quarantine, or both. And, we really need to be in this together. Don't wait for that phone call, because remember, there can be delays in reporting. And the truth is that by the time a case is sometimes reported to us, they may be out of their infectious period. That's why we need everybody to be part of this team, especially if you're a business, if you're a school, if you're a congregate setting where folks may be exposed. Everybody needs to play their part in all of this.
I think that's a great point, Dr. Byers. It's not just one thing like contact tracing. There are many, many ways to decrease the spread beyond contact tracing. Like you said, properly quarantining and isolating. We also have one question about our turnaround time in notifying people that they've been exposed. Dr. Byers, do you have that?
I don't have that average turnaround time, but I can tell you that our teams start working on it as soon as the case is reported to us.
Thank you. Will Stribling with Mississippi Today. The public universities are required to submit reports on the COVID tests they conduct. Why doesn't MSDH publish the data the same way it does for K through 12 schools? Is that true, guys? Do we require?
That's a different kind of reporting.
Okay, can you explain that?
Yeah, sure can. So public universities that are conducting the test report them to us. There are cases that may occur at a public university that are not tested by that individual university. Sometimes they do community testing that doesn't include necessarily students. So that's an individual test report. That's different than the types of reporting that we're getting through the K-12 setting, which is data to determine what the impact is in the school as far as the number of cases, number of outbreaks, number of quarantine, different data.
Okay, and Will is asking about how can Mississippi Today get regular access to the weekly data that the public universities are submitting?
Well, certainly they can, we're more than grateful for them to do a data request to try to identify the number of tests that specific entities are reporting to MSDH. And if we're able to tease that data out, we'll be pleased to get them. But another good way to do it is to contact the universities themselves.
Right.
Many of the universities are doing their own reporting of the number of cases, number of quarantines, number of outbreaks, and I would encourage you to access that data.
Exactly. And the same with the schools. You all say, why isn't this person reporting? Why isn't that school reporting? Contact the schools. This is self-reported information. Ask the schools why they are not reporting. Okay. Thank you, Dr. Byers. Let's see. Can you tell me the county the death occurred in? No. What is the transmission rate in DeSoto County? Anybody know that off the top of their head?
So DeSoto County does not have one of the highest rates right now, but over the past couple of weeks, it's had a higher number of cases. But when you look at that number of cases on a per 100,000 population, it's not one of the top counties right now. What I would do, guys, if you have interest in where your county is, what's going on in your county, we publish on our website county-specific data that shows you the number of cases, the age group that they're coming in, whether or not they're associated with an outbreak, the racial breakdown of those cases, and we even put in there some additional surveillance data. So I would encourage everybody who has interest about their counties and where they stack up against other counties is to look on our website. We do have that data available.
You. Yeah, and we get a lot of questions, and I tell reporters, go look at our website first. There is a ton of data on there, so get familiar with what's on there.
But all that to say is, I'm not aware of anything specific in DeSoto County at the moment, other than they have had a lot of cases. That looks like the vast majority of transmission is community transmission. We've not identified any concerning outbreaks.
Thank you. And I answered you shortly about the county. The reason I can't do that is because that could lead to identifying the child or the parents. We err on the side of being very conservative as far as giving details about counties and cities and ages, and that is to protect our patients. They have the right to that privacy, and it really doesn't add, I mean, you're getting the public health information. So I should have explained that a little bit more than just saying no. Courtney Ann, how many of those pregnant women who died were able to safely deliver their baby before passing? Dr. Dobbs, do you have those kind of details?
I have spoken to a couple of hospitals, and they have informed me that the babies were born premature but are alive. So we've got additional investigations ongoing, but it's a tragic and difficult circumstance. And again, we want to avoid this if at all possible by protecting the moms with vaccines and antibody treatment.
Yeah, and of course, maybe next at Thursday's press conference, we can perhaps talk a little bit more about that. Courtney Ann is referring to the MISMA chat where you said that there were many, that there may have been some C-sections performed at the last minute. And
with that one physician who I referenced, when I checked yesterday, all those babies were alive and getting treatment in the neonatal intensive care unit.
Okay, thank you, Dr. Dobbs. Mr. Jim Craig, this is coming to you. We did go over this, but what's the status of the contract healthcare workers? Have they all arrived? You did go over a lot of that. Would you like to just answer that real quick? I know some are still pending.
Yeah, and of course the request have changed to some facilities, and some things have moved around a little bit, requesting additional resources in other facilities. Right now, there's 1,136 folks between all the different disciplines that have been requested. MEMA's working to get some updated percentages on exactly how many have been deployed, but it is above 75%, as I understand it right now, have been deployed. But I imagine MEMA will be providing some additional information, updates on that percentage here shortly. I do know that both the governor's office, MEMA, and the health department, and the licensing boards that are providing the temporary approval for a lot of these folks coming from out of state to assist us here in Mississippi, have been working really long hours and days trying to make sure all that happens as quickly as possible.
Okay, thank you. Concerns about impacts of Labor Day. We always worry about holidays and gatherings. Dr. Dobbs.
Yeah, we're always concerned about holiday weekends because they do seem to be an opportunity to spread COVID. We didn't see a big bump after Labor Day last year. It's hard to know for sure. Certainly, Memorial Day can be a risk, but it was not too bad. So I think time will tell.
Okay, and now to college football. Dr. Dobbs, is it safe for stadiums to be full again? Dr. Dobbs mentioned in Friday's chat, I'm assuming that this is the NISMA chat, that he thinks we've reached an era of risk reduction, not risk elimination. What should that mean for attending sporting events?
Well, first and foremost, take care of yourself and be conscientious of your own safety, right? So be vaccinated, be careful, wear a mask when you're indoors around other folks. The risk of transmission in an outdoor environment is probably pretty limited. I mean, can it happen? Yes, if it can, but we haven't seen big outbreaks. If you, understand that there's risk if you go to a football game, and if you have a weakened immune system or maybe a little bit older, you may not want to go. And if you do go, for heaven's sake, please wear a mask when you leave your seat to go to the concession stand or when you're crowded trying to get in and out of the stadium. We can still see transmission and there still are vulnerabilities there. But there are ways to do it safer, and masking indoors and maintaining space outside and spacing as you can are going to be important strategies to keep yourself safe.
Okay, thank you, Dr. Dobbs. Mr. Jim Craig, I'm going to start with you on this because you're out in the field. Let's see, Shalina is saying, I know Mississippi didn't see severe impact from Ida, but do you have a sense of whether vaccinations might be set back or there might be a COVID surge from people who were gathering or sheltering in place? I'm asking you this because you are aware of the sheltering and you could address that. Did we have a lot of people sheltered? Were a lot of people in close quarters?
And we did have quite a few people sheltered from Louisiana for the most part in some of our shelters, and a lot of Mississippians that were sheltered as well. I don't know that we've seen any patterns of increased transmission from that sheltering operation. It may just be a little early for us to be able to discern any of that. But I will say that the storm did impact some of our vaccination opportunities. Obviously, with the loss of power in some areas, a number of county health departments that we had to move vaccine away from because of power outages, there were a couple of days that we were not able to vaccinate. So that probably may have artificially skewed our numbers down a little bit for that particular time frame. But I do think the demand is still there. It was just a matter of those opportunities not having power.
Right. And also, how has the storm affected hospital capacity? We did chat about this last week. You want to touch on that again? Yeah,
we're seeing some, much like we experienced Hurricane Katrina, right? 16 years ago, where we had folks going to our neighboring states for healthcare and actually many places around the country for sheltering operations. I think we've seen some folks from Louisiana accessing healthcare here in Mississippi, and obviously that has had some impact. Our hospitals seem to be adjusting well, and obviously we understand that there's a great debt that we still owe to a lot of states that assisted us in Katrina, and we look forward to trying to help Louisiana at the same time. I do know that some of the dialysis patients, you might remember Katrina, we had those significant problems with making sure we had dialysis services available for the population that was without power. I know that we have been taking some of the dialysis patients over from Louisiana to make sure they get those much needed services here in Mississippi.
Thank you. Kevin Cooper from Boone Newspapers. Dr. Byers, this looks like it's coming to you. Dr. Byers advised not taking ivermectin for livestock or any other livestock medicine. I think that's a little bit mixed up, but we did advise that you talk to your provider about that. Was Dr. Byers just covering his bases with the other livestock medicine reference, or are you aware of any additional types of livestock medicines that people are taking? If so, what other livestock meds are people taking? I think why don't you go ahead and address that?
Yes, ma'am. Thank you for the opportunity. No, I'm not aware of any other livestock medications. I just want to be clear that let's don't try to self-medicate, guys. Let's don't take any livestock medications, whether it's one that we know that people have been taking, like ivermectin, versus other livestock medications. Let's just don't do it. It's not indicated in people. It's dangerous. The thing that I just want to make sure that people understand is talk to your doctor. Follow your doctor's advice. Take medications as prescribed by your physician. And certainly if you are COVID positive, talk to your doctor about monoclonal antibodies or call our hotline where you can obtain resources and be connected with places that are providing monoclonal antibodies in your area. So let's take advantage of the medications that we know are proven to reduce the severity of illness and save lives. And that's monoclonal antibodies. Let's don't try to self-medicate, is really the point that I'm trying to make.
Thank you, and well done. Now, do we know about hospitalizations from ivermectin? I know for a lot of details, we have sent this over to UMC's poison control.
I'm not aware of any additional hospitalizations that have been reported. You know, we did have a couple of early on when we were first becoming aware of the fact that folks were taking ivermectin that was intended for livestock. I am not aware of any additional hospitalizations that have occurred.
Okay, thank you. Jim Craig, this goes to you. You said that 75% of the over 1,100 healthcare workers were deployed to hospitals. Are you referring to Mississippi hospitals, or were they diverted out of Mississippi to help out-of-state hospitals with Hurricane Ida relief efforts? Thank you.
Oh, that's a great question. And there have been a lot of resources from around the country that are moving to assist Louisiana with Hurricane Ida. As far as the resources I was speaking to, the 1,135 folks and over 75% are already deployed or to Mississippi hospitals. We've received staffing assistance requests from 63 hospitals now. So those staff that I was referencing are ones going to those 63 Mississippi licensed hospitals.
Sorry, guys. I thought I had unmuted myself. All right, Steve with Super Talk. A woman under 30 with symptoms tested positive for COVID and was told she wouldn't qualify for monoclonals. What exactly is the criteria, and what treatment options does someone have who doesn't qualify? Dr. Dobbs, let's start with you.
Yeah, so the criteria are very broad, and the vast majority of people in Mississippi qualify based on the criteria. And if you go to our Health Alert Network message that we sent out just yesterday that talks about monoclonal antibodies, the treatment criteria are there, but they're very broad, and it's actually basically at the discretion of a physician if they so choose. So, visit that. But if you consider a lot of the criteria, if you have a BMI over 25, body mass index, that's going to be about, my BMI is 24. So that tells you that you don't have to be much bigger than me and you qualify if you have any medical condition, and then other factors. So it's very broadly available. There are no other effective proven treatments early in the course of COVID. But, I would certainly, if she didn't think that she got a good shake, a second opinion is something that's always worth checking into.
And Dr. Dobbs, if your BMI is that, we're all in trouble. We can all
Yeah, let's don't start confessing our BMI.
I believe me, I would not. Okay, Brittany is asking, I noticed in the beginning, businesses took down names and numbers. I don't see that happening really anymore. Is it required? I'm not sure. Anyone understand that question?
Yeah, it's not required. Many businesses used that as part of their process for being able to identify folks through contact tracing, and it was certainly an admirable effort, but it's not a requirement, and I'm not aware of any businesses that are doing that as much. But we do encourage businesses to certainly identify those employees who may be contacts or cases and get them excluded from the workplace.
Thank you. Brenda Goodman with Medscape, and this is for you, Dr. Dobbs. For clarification, the 8 deaths in pregnant women that Dr. Dobbs mentioned, what was the time frame for those exactly? And were these women all pregnant at the time of death or maternal deaths? The women died shortly before or after giving birth. I don't know how many details you have right now, Dr. Dobbs, and I know we're going to be investigating that for next Thursday's press conference.
And of that 8, I know that they were all from the Delta surge, so since August 1st, but it appears that they pretty much all have occurred in the past 4 weeks. But we're getting precision on that as we go forward. You know, what I also understand, it was during the course of their pregnancy hospitalization. You know, many of them, you know, had emergency C-sections and that sort of situation. So it looks like it's during their, you know, well, they were admitted because they were sick and they had a C-section. It wasn't their scheduled delivery time, right? They were just sick because they had COVID and they did everything they could to save the baby before the baby died in utero. But we'll have more details coming forward as we get that information. We only have the raw numbers reported from the hospitals right now.
Thank you. And do you think we'll have more information next week, Dr. Dobbs?
Oh, yeah, definitely.
Good.
I'll stake Dr. Byers' reputation on it.
Well, our special guest will certainly be able to give us a lot of details.
Yeah, I think so.
All right, so let's see here. Okay. Kevin Cooper, to follow up on Brenda's question above, and to be clear, of the 8 deaths in pregnant women, how many of their babies have survived? How many did not? And was the most recent pediatric death related to one of these pregnant deaths? All right, Dr. Dobbs.
You know, we'll get more information on that. I do know from the one center I discussed that the babies are still hanging on, so that's great news. And I'll let you know, the pediatric death that we're reporting is not related to a maternal death.
Thank you, Dr. Dobbs. All right, Isabella Murray with the Biloxi Sun Herald. Are you seeing monoclonal antibody hesitancy like you are vaccine hesitancy? Do those who have turned down a vaccine have an aversion to the infusion? All right, Dr. Dobbs, you want to take that?
Yeah, sure. You know, I'm not aware of any specific hesitancy about the monoclonals, but what we are seeing from time to time, and I've heard from some of the ER docs, is people who want to dismiss the severity of COVID-19. And so it's not so much a direct, you know, rebuff of monoclonal treatment as much as, you know, people falling into the complacency that COVID's not dangerous. COVID is extremely dangerous. COVID killed over 1,000 Mississippians in the month of August. Almost all of those people did not have to die. COVID is scary and Delta is deadly. So I think it's really more of a lack of appreciation for the real threat we're looking at to the individual's life and safety if they do not get treatment when they're diagnosed with COVID.
Thank you. Debbie Skipper from MCIR. Dr. Dobbs mentioned the doubling of deaths of fetuses in unvaccinated women. How many are we talking about?
Boy, I have those numbers, but they're preliminary. So can you come back to me that in a second and I'll pull it up?
We sure will. Stephanie, will you remind me? Okay. All right. Ashton Pittman with Mississippi Free Press. Can you give us racial demographics for child deaths and cases? I know, Dr. Byers, that we have put out, we don't put exact ages, You want to address that a little bit?
Sure. And we do have racial breakdowns for overall cases and deaths on our website. We don't have that specifically for cases under the age of 18 or
Right.
deaths under the age of 18. We can look at that, but it's going to be important for us to do this in a way that does not compromise a person's personal identification. We want to make sure that we protect folks
Right.
and families' identity as best we can. But we can look at trying to provide that data, and we'll be pleased to do it if we can.
Okay, thank you. Yeah, we definitely want to stress we err on the side of being conservative and protecting our patients always.
And Liz, I have that information. I did find it.
Oh, good. Okay, go ahead.
We have identified 72 fetal deaths, so associated with pregnant moms who had COVID, which is twice the background rate of what would be expected. So that's quite a number of tragedies that sadly would be preventable right now.
And what's that time period on that, Dr. Dobbs?
But that's for the whole pandemic since
Okay,
the
thank you.
beginning of 2020 pandemic.
Okay, thank you. Okay. All right, let's see. Isabella Murray, K through 12 schools have been in session for about a month across the state. Has the number of students who contracted COVID been on par with your expectations? What trends do you foresee over the next few months in schools, Dr. Byers?
The trends is harder to tell. I wish we did have a way to be able to predict where we were going to be over the next few weeks to months in the school settings or in the pandemic as a whole. It's you know, as far as what our expectations were going into the school year, we knew that it was going to be a challenge because we were at the very beginning of the Delta surge, really, when we were getting our kids back into school. And I think we saw that right away with a number of schools that started back almost immediately had to go to you know, virtual or some hybrid learning. I think we've seen some encouraging things over the last few weeks with our schools. I think more of our schools are really trying to put in place those measures to prevent transmission. With our reporting that we had in the most recent report, 80% of the schools that were reported to us, that actually reported to us, had elected to make masks required in indoor settings, regardless of vaccination status. And really only 5% of the schools in the last week report had to go on virtual or hybrid learning because of the number of cases or outbreaks that were in their settings. And that's compared to 10% in the prior week. So I think we're seeing improvement in the school settings. I think the schools are working very hard to try to limit transmission and put in place that best guidance that we have out there to limit transmission. I think really these next few weeks are going to be pivotal. If we can continue to get our case numbers down, if we can continue for folks to get vaccinated, hopefully we'll have expanded eligibility for vaccine for younger age kids soon. We don't have a time frame on that, but I think all of those things together are really going to be what's needed for us to keep our kids in school.
Okay, and Dr. Byers, do you know how many contact tracers we have now?
We have about 150. And, you know, I'm going to tell you, there's been this focus on contact tracing from the very beginning, and there's renewed focus on it now. And certainly notifying contacts and making sure that people are isolated and quarantined is an appropriate measure. It loses some of its ability to limit transmission when we have overwhelming numbers of cases that we've had recently. I think the real focus, the real thing that is going to pull us out of this pandemic is our continued vaccination efforts. And that's where we need to continue to focus.
Thank you, Dr. Byers. And I am, Mr. Jim Craig, going to throw this one over to you. Leah from the AP, have the parking garage field hospitals at UMC been dismantled because they are not needed due to a decrease in hospitalizations, or because hospitals are now getting the support they need to expand their capacity through the additional healthcare workers sent there?
I think it's a little blending of both. You know, we are seeing some leveling off in hospitalizations in some areas of the state. I also know that the decompression processes that we were having to do early on have been relieved a little bit. But I can't help but believe that being able to provide some of these much needed healthcare workers into these hospitals has really also made more spaces available and freed up some staff to be able to take care of more patients.
Thank you. And I have put in the call for any last questions. And so I do not see any last questions. So we'll just go around the room. Dr. Dobbs, what would you say to a pregnant patient? And tell me why you would tell her to get vaccinated.
You know, the COVID vaccines are phenomenally safe, and they've saved so many lives in our country and in Mississippi. If you want to have the best chance for you and your baby to get through the pandemic and to thrive, you know, please get vaccinated. But if you do get COVID, don't just go along like there's nothing else to be done. Pregnant women need monoclonal antibody treatment if they get COVID.
Thank you, Dr. Dobbs. Dr. Byers, the Delta variant greatly affects pregnant women, correct?
It does, and certainly we've seen an increasing impact throughout this pandemic on pregnant women. We know that women who are pregnant, just like with a lot of infectious diseases, but more particularly with COVID and with Delta, are at higher risk for complications that can occur from the infection and ultimately can lead to hospitalizations and unfortunately to deaths. And you know, pregnancy is a time when you can be at risk from a number of things. We want folks to go ahead and take advantage of everything that they can to have a healthy pregnancy, to have a healthy baby. And that really includes getting vaccinated. And I have to tell you, just to share a personal story, you know, my daughter has recently been pregnant, and we were grateful to have her deliver a healthy baby, but she was vaccinated during her pregnancy, and we did that without hesitation. And I would encourage anybody who's out there who's pregnant, if you have questions about it, talk to your doctor. But we encourage you to please get vaccinated. That's going to be the best way to ensure that you and your baby stay healthy.
And congratulations again, Dr. Byers. Your baby is beautiful.
Thank you.
Yes. And Mr. Jim Craig, the daddy of all and granddaddy of all, have you had these discussions with your children?
You bet. And you know, my daughters are all vaccinated, and a couple of them have had children, and they're all doing well, as Dr. Byers alluded to with his. You know, they're all doing well with it. I would just say that, you know, as I mentioned last week during the press conference, it's getting easier and easier to find Mississippians that have a story about the tragedy from the Delta variant. And don't let that be a pregnant mom and an expectant family.
Thank you. Thanks to all of you. On behalf of State Health Officer Dr. Thomas Dobbs, State Epidemiologist Dr. Paul Byers, and Senior Deputy and Director of Health Protection, Mr. Jim Craig, I'm Liz Charlotte, wishing you a good afternoon.
Thank you all.